was taught by a woman in the Limbe Regional Hospital, and I'm highly grateful for that. Thank you very much, madam, for this technique, for this beautiful technique that you told me. In the YUWUN technique, what do you do? The first element in the YUWUN technique is to do a cervical stripping. You wait for contraction first. That's the first element in the YUWUN technique. You wait for contraction. Is it clear? You wait for contraction. Now, during contraction, that's the second element of the YUWUN technique. During contraction, you do cervical stripping. So you do cervical stripping. During contraction, you do cervical stripping, and you also do you also give the patient antispasmodic, particularly fluoroglycinol. Is it clear? Glycinol. You do it. You give 2 ampoules of fluoroglycinol, 1 to 2 ampoules of fluoroglycinol, 65 milligrams. Is it clear? So fluoroglycinol, you now give fluoroglycinol 1 to 2 ampoules during contraction and when you are doing cervical stripping. Is it clear? So when you are doing that, you wait. Is it clear? You wait again for another 2 hours. Is it clear? When you are doing again the next vaginal examination, and when you are doing again the next vaginal examination, you still with the contraction, you do cervical, during cervical, you do cervical stripping with antispasmodic. Is it clear? Generally, I've seen this effectiveness to be, I've calculated on a small sample size of 20 patients. Is it clear? And she did it for all the 20 patients. She had a success rate in 18, where 18 patients were having a cervical dilatation of 0 to 10 of 4 to 10 centimeters within 2 hours, within 2 to 4 hours. Is it clear? So the effectiveness rate of the YUWUN technique was calculated to be something like 96%. Is it clear? So I was highly marveled by the effectiveness of this YUWUN technique. So you can try it in your hospital service. Is it clear? So you wait for contraction, and during contraction you do cervical stripping, and then you give fluoroglycinol 1 ampoule. Is it clear? So when you do it, you wait it again for 2 hours for the next next cervical examination, and then you do that. I've seen that usually in all the patients. I've seen it for 20 patients, examine 20 patients. 20 patients were starting at 4 centimeters, were even out of the active phase of labor, and then she did her technique within 2 to 4 hours. 18 of them had a good success rate. 18 of them have given birth within 2 to 4 hours. Is it clear? But now, the only 2 failure rate, she had 2 failure rate. Is it clear? And those 2 failed cases that I've seen with the YUWUN technique were because we're immediately gone to the surgery for cesarean section, because those one were cephalopelvic disproportion. Is it clear? And she is the same person that has diagnosed as cephalopelvic disproportion without even waiting till the end of the partogram, because she had another technique where she evaluated the caput. Is it clear? And then she saw that the caput ratio is to the internal os ratio was very there was a large margin within the external os diameter and the internal os diameter. She had evaluated that the external os diameter and internal os diameter, when it is greater than 10, it's already a huge diagnosis for you to have cephalopelvic disproportion. So the patient had a huge caput, and then those 2 patients that had the caput that she could not do successively the YUWUN technique, they were immediately brought to cesarean section after having the diagnosis from the partogram and an arrest of the cervical descent from the partogram. So that is the YUWUN technique. Now, the next thing after that, after speaking about the latent phase of labor, you have now to manage the active phase of labor. Is it clear? So in the active phase of labor, the management is just to monitor with the partograph. Is it clear? You monitor with the partograph, and I've told you that if you want to know the different element of the partograph, you just come and ask, and I'm going to explain you better. But you need to know that the monitoring of patients in the active phase is after every 2 hours. You do vaginal examination after every 2 hours. You measure the fetal heart rate after every 30 minutes. Is it clear? measure the fetal heart rate after every 30 minutes. Now, provided the patient has high infectious risk, is it clear? Like in the case of premature rupture of membranes, when the patient has premature rupture of membranes, you only monitor her after every 4 hours. Or she has a high infectious risk, like in the case of a patient has HIV, you also monitor her after 4 hours. Is it clear? Provided the patient this is when you are in the first stage of labor. When you're in the second stage of labor, the monitoring is done after every 15 minutes of the fetal heart rate. Is it clear? Now, the next thing, so after monitoring, this is for the monitoring of cervical dilatation and cervical descent after every 2 hours. This is the monitoring of the fetal heart rate after every 30 minutes for the first stage of labor, and after every 15 minutes for the second stage of labor. So those are the different elements that you have to evaluate the patient. Is it clear? You have also the meconial stain. So those other elements I'm going to explain only if you ask me the question. Now the next stage is the stage 2 of labor, where I'm going to speak about the mechanism of labor. Thank you.